Good morning, class. My name is Emmanuel Mobile. I'm doing a training on the importance of the risk department or the risk program to the healthcare. And let me be specific in hospitals. Now, by the end of this training, we'll be able to understand the importance of the risk management program to all healthcare institutions. All right, now, the first thing is how do they determine the risk? They determine the risk by identifying the risk. And the next thing is prognosis. That's the risk, estimate the risk, the effect of the risk onto the patient and to the entire organization. Then you have managing the risk is exactly how the risk manager controls the amount of risk. Now, examples of this risk are the errors caused by medical doctors and nurses, which are normally referred to as malpractices. And as you will see here, there are 5 cases of malpractices that has happened or risk that have legal ramifications on the healthcare industry. For example, this is Jacqueline Logo. Now, he had a severe brain injury. The damage was caused during childbirth, and it cost the healthcare organization 18.2 million. Another one is Tiffany Bosso. It happened in 2009. She's wheelchair bound. Now, it happened during birth. This error happened during birth, and the child had permanently brain damage. It cost the hospital $45.5 million. So those are the effects the risks have on organizations, and that is what the risk management program is trying to eliminate or manage. Now, other functions of the risk manager or risk management program is to coordinate the activities or reports regarding risk with the healthcare, with the human resource department and other legal departments. For example, the risk manager gets the reports of risk or near risk. He submits them to the human resource and comes about ideas how they can reduce the risk. Now, how does he reduce the risk? Then they recommend training. That's the control they do. The control is recommendation of trainings, looking for methods to make the practices safer. For example, reducing falls by patients. They might decide that we have to buy beds that have beds that are safe for the patients to sleep on, and even the parts they put on the floor, they have to recommend parts that are not slippery for patients, that can cause patients to fall. Patient fall is one of the most common risk factor in hospitals. Example, what UPMC do? An example is UPMC. What UPMC of this that does is the nurses actually go to the manufacturers themselves and make sure that the manufacturers manufacture the standard UPMC requires so as to protect the patients. Now, what are the advantages of the risk management program? There are so many advantages of the risk management program. One, the risk management program, it reduces the amount of risk that the hospital is supposed to have, and then it reduces the amount of money for medical malpractice. For example, if there are less risk, the medical malpractice insurance has to be very low. Another advantage is it improves the services efficiency and effectiveness by training the nurses and those who work directly with the patients on how to avoid the errors they already committed. And the disadvantages, there are so many disadvantages. As we've seen, you see one case here costs about 45.5 million. And then another one costs 18 point something million. There's so many of them. If you have, that's just one case. If you have so many cases, what do you exactly think the hospital will go bankrupt? So that is exactly what I wanted to let you know, that the health control managers